I hope this session will be a very relaxed because the topic is, very tough. It is nutrition and obesity, and look at us. I think on average you are good. You're very good, and I think I'm very proud because we have also a very expert in the front row, P. Jintana. Okay, so I think what we talk today will help not only yourself, but also the one whom you care for. So I just think that a little bit of introduction. Here in this slide, I also add my credentials here, not to boast myself, but I think it is comfortable of all of you that nutrition is not a very easy task, because many people claimed that they are good in nutrition, and they just propose a lot of formula for all of us. Sometimes there are many ideas throwing in the internet. I think if you are the very keen searchers or the internet hawk, okay, you will find a lot of information. So today I have to define my credentials so that the information you have today, I think I had quite a background for you to, from now on, I hope, to be a little bit not shaky by the overflow of the internet information. Okay, so I have a bachelor in pharmacy, in the master in nutrition, and PhD in biomedicine. Okay, and I have the American board, which I think I am the only one in Thailand who got this clinical nutrition support clinician American board right now, but now we will have more. And then the European Society of Parenteral Nutrition, which is the best organization in the world who delivered or give the kind of the very precise science in terms of clinical nutrition. So you will hear ESPN here, ESPN. You will hear ASPN, ASPN. ASPN is American Society of Parenteral Nutrition. So in Thailand we have SPENT, Society of Parenteral Nutrition of Thailand, which I am one of the executive committee, and I am the master of the website, so that if you want to visit the Thailand website, you can go to worldwideweb.spent, S-P-E-N-T, spent.or.th. Again, worldwideweb.spent, spent.or.th. This is, I'm doing that website, and we are creating the English version. Okay, so this is the kind of the credential, and then also I would like to express a little bit on the work that I work with the WHO, the World Health Organization, so that we work internationally, and the kind of the perspective that we have is very important, not only the academic background. So I would like to express to you that I have a lot of empathy to many people, not only in Thailand, but in the world, that we are flooded with information. And then today, how do I eat? I eat for my blood group. I eat for my, this day, this is Wednesday, what do you eat? This is a Saturday, what should you eat? So we are, just, what is that? So please, today, please feel free that you can interrupt me anytime. I love that. And then, because I think it is quite difficult for me to prepare this session, but I try my best. Okay, so I got the food safety credentials. I am the only one from Thailand in the 15 persons in the world who is invited for food safety strategy planning of WHO. So this is right now I am the one of the focal point, Thailand focal point of InfoSan. You can search that because we are the network in the world who, when everything happened, like, oh, there are kind of like strange bacteria contaminated in the infant formula. So we spread the news. And then WHO asked, hey, in Thailand, do you hear the news? Do you, something like that. So we communicate. So we have this kind of network. Okay? So this is the thing that I work with. And I have been working with Mahidol University, the Faculty of Pharmacy, for 24 years. And after that, this is now 10 years that I work for Chulalongkorn University. So I, like Pijin, she's at Mahidol University, we met. And then, so I kind of explain how old I am because I have worked for 34 years and I am going to be retired very soon. Okay? So next one, I just show you the slides so that I am in a meeting. This is the food safety, global strategy of food safety in Geneva, which is one, I am one of 15 persons. I'm going to Myanmar for the high task force meeting for tobacco and many areas. And then in the World Health Assembly, I am talking in front of 191 countries to stand out our stand background about obesity, because that is the time that we are talking about the infant, young child feeding strategy. And I'm talking here in front of a lot of people that Thailand insists that we have to mention about combating obesity in infant in the strategy, in the, the thing that led out. So if you go to search, you'll find my intervening, about this one, because we, Thailand, we insist that obesity is the problem because WHO always see the, the child which is very skinny and very poor, So another thing, the last thing I will mention about my experience today is the brochure that you got. So today I bring it in both in English and in Thai. Okay, so I hope everyone got the brochures. So there are there are one people who. Okay, so I have brought the brochures so that if you. So it's sorry that it has the same color. Normally I try to be kind of like different colors so you know what is the English version is Thai version. So here, English version here. So please raise your hands for yes. So that I think I will bring fresh experience from what I'm doing. The Healthy Monk, Healthy Nutrition Project in Thailand. Right now I go to all 4 regions of Thailand, including Bangkok. So I just will let you know that first I study the problem of nutrition and health in monks. So everybody knows that Thai monks or any monks in the world, Buddhist monks, when they are offered food, they cannot reject or they cannot doing any manner, not polite, but they just have to, receive with calm or happiness. So whatever food the laypersons has offered has influence on monks, and you will be shocking because right now I'm going from Chiang Mai, Pisanulok, Ubon Ratchathani, Khon Kaen, Ayutthaya, Ratburi, and I'm going to, next week we're going to Songkhla and Surat Thani. So we will cover all parts of Thailand, and there are many shocking messages from the research. We're doing qualitative research. It is in-depth interview of the, both monks, laypersons, and also novices, small monks, the novices, and we will be shocking. So I'm doing this job, and we have visit many monks in Bangkok, four temples in Bangkok, and then we create the media. We call it educational media. So I will also mention in this class, because this is the way to change lifestyle. So we will say that combating with obesity is not easy. I got 12 million baht from SSS, Thai Health, to do this kind of job. 12 million baht. So it's not easy. So we have to study. We have to know to the root what is the cause of their, it may not be like what you see. So here, and then there are Reuters, Thai PBS, and many Chong 3, Channel 3, and many, I think, to film or to interview us about what happened. They are very, very exciting, And this is the kind of media that we invented, I will mention to you later. But right now, I think it's time, to start with nutrition and obesity before we elaborate more. So this slide I have from the International Congress of Nutrition in Thailand in 2009. It happens in Thailand, and it is not very easy to happen in Thailand, I think in like 100 years. So at that time, there are professor who is very, very, worldly, highly reputed. They have very famous Barry Popkin. So Barry Popkin is a professor in nutrition epidemiology in University of North Carolina, Chapel Hill. We call it UNC. So University of North Carolina is top university in terms of nutrition in the world. So Barry Popkin, he studied a lot about, what happened in the world? Why the world is so heavy? Like we have so many million people who are getting fatter and fatter. So he is a very serious person who do a lot of jobs. So I did not bring up all his slides for you, but just to let you see that, what happened? What happened in all around, like Thailand or in the Western countries? What happened about health? And do we, in this room, we will let it go? So we think that it is how we can deal with it. It is environment change. But I think that maybe you can do something. So Barry Popkin used the word, the world is fat. If you are like kind of fan of the word is flat, right? There are very famous books, top selling. The word is flat. So that emphasizes the kind of globalization. So right now we can reach everybody. And when you are, staring at me, you will hear boop, boop, boop. So if you leave your telephone, just, so you can connect with people so far away from you in real time. And when they are sleeping, my friend, she is in the States. So she is like, hi, how are you? So for us, it is midnight. And for her, it is midday. So we connect all the time right now. So the word is flat. It means that, we have no level. We have no hard things to reach our friends far in the other globe or okay. So I think he is saying that, hey, look, right now the world is fat. What do you see? So these I quote from CDC. So you can rely on the information. I try to introduce to you the name of organization that is quite reliable, so that you will, at least when you have questions, you can go to some website that is, reliable. So this is CDC. CDC is Center for Disease Control, something in the US. So there are big organizations who deal with the big problem like disease control. So from CDC, you see that obesity is what we call epidemic. So it's kind of when you got diarrhea and you got typhoid something, and you said, oh, it is epidemic because people in the village, they got half of the village got typhoid or something. So that is epidemic because they spread very rapidly. So here, like obesity, even though it is not an infectious disease, but it spread. It spread. Why? Okay, so more than 1/3 of U.S. adults, and it is over 72 million people, okay, of U.S. children are obese, okay, so right now the rate is double, so obesity rate is very alarming, okay, so we have maps, okay, just to let you know, I think I think people in this room are not interested with the real number of figures of these, but you just look at the color. Okay, blue color, it means that there are low percentage of obese people, and that in the red corner here, it is like increasing, prevalence or increasing number of obese people. So you see that in 1990, the US has quite blue. Okay, so the incidence or the number of obese people is quite low in different states of the US, okay? But for 10 years later, blue is more blue, even, and there are quite in the tone of like yellow or orange or red here, and in 2010, you see that the states in the south is more very obese. What happens? I don't know. I don't go, I never go to this area, but I go to this area here, Boston something, and California here. So in those areas, maybe people are richer, and then they have more education, okay? So they don't let themselves, eat whatever. So I don't know, it's just my guess here, why there are differences in terms of obese people, number of obese people in different areas in the US, okay? So for us, we just apply with the idea of rural and urban, okay? So those in urban, we don't know that the urban is more, there are more obese people compared to rural, okay? So in the old days, we think that if we say about rich and poor people, we think that rich people in Thailand or in China, if we are rich, we will be like Asia, right? So it's kind of like those guys who want to have a very round belly, and when they stand, it looks like Hong Kong, it looks like a king, or those who have something to eat. We are saying like that. So that is the attitude of Thai people in the old days, okay? So we think that only rich people are fat. But right now, I think the world is changing. It's changing, okay? So the old days, we think the rich are fat people. So right now, in developing countries, and especially Thailand, China, okay, we have more, very fast. The rate of obese people, numbering is increasing very fast. So they are guessing that it will be because fast foods, or because of the, increased consumption of the more energy-dense nutrient foods. and combined with movement. So we all only move our fingers, right? So our fingers is very strong, okay? Okay, so like what I mentioned to you about WHO, the World Health Organization, they just think only a poor guy, poor boy, something like that. So that is all day. I say that, okay, that's fine. That's maybe in Ethiopia or Zaire or in some, Congo or something. But here, when we look at, we come from Thailand, and we know that right now the problem of not having anything to eat is less and less, but this thing we don't see. But here, I would like to propose on my own experience. I met a boy here. He is 4 years old. His body weight is 50 kilos and 50 kilos and with his mother. At first, I don't ask about his age. I think he is like 7, 8, something. But he is only 4 years old, and when he stands with his mother, he is like in the, up to this part, this is his head, okay? He is this tall, and he's just 4 years old. And if you look at how he eats, okay, that is very horrible, okay? So we see that this kind of thing happens in Thailand. He eats in the table until it, choking out, okay? So I just think, mother, how you feed him, okay? So this is not just happening only in Thailand, I'm sure. So it happens in many countries. And in Australia, this picture, you will find it in the internet. It is very popular. It is observation of Australia, that in the past, the body, the shape of the boy is like this. Straight, no belly. Very, lean arm, something like that. But when time passed, right now, the shape of the boy, average, in Australia is like this. So and what will happen for the adults, Australian adults, in the future? What will happen about the, kind of disease that they will get? If the generation, what generation? Gen Z something? Gen Y, Gen Z. So the new generation, you see, is to be of concern, right? That there are consequences, which we will mention, will be very, very, horrible. So it's not just only, children like this, but the very, very infant, okay? So just infant, we find it, and we hope that the attitude of, feeding the children or infants will be changed, okay? With you don't see that the kind of like a average or looking quite lean in your eyes. You should match with the standard graph and be confident that your kids is not like looking sad or something, and you try to eat, please eat, okay? So if you dump the food for them, it will look like this, and you say, oh, you're cute. But, okay, please be responsible for my health in the future, please. Okay, so this is the kind of the prevalence or how much or the frequency of obese people in Thailand. The data is from, I think it's 5 years back, okay, in Thailand, which is the latest data we have right now. So when we see the trend from here, sorry, can I use the Buddhist era? So it is like 34, and then 40, 47, and 52. So we have the comparison of how, how much or the frequency of the obese people we found from. So it is most ladies, please, ladies is more obese than the guys, okay, the males, okay, so, okay, I talk about ladies, 21% obese in 34, and right now we are double, from 34 until, so this is kind of like around 20 years, okay, 20 years past, we double, so this is alarming for me, so please, you will, are the kind of the good messenger today that, hey, why don't we stay fit? Why don't we let ourselves when you wear the very big clothes and then you don't know how much weight you are gaining. Okay, so please use the clothes that is, no elastic, things like that. Please throw it away. I throw elastic kind of like a skirt away many years ago. It is our enemy, okay? Okay, so I would like to bring the idea that even though you are like a kind of like the label is lay, but I think you can have such a subtle or a clear definition of obesity, because when you talk to people, they just say, oh, I am the diet. I'm controlling my weight. So the weight, body weight, when you go to the scale, you just look at the scale, and that is the way that you judge. But look at the definition, okay? CDC, the US, they say that the overweight and obesity are ranges for weight that are greater than what is generally considered healthy for a given height, okay? There is weight, there is height, weight at this height. So this is the relationship between weight and height. So my question is, do our body, what is the weight? Consists of our muscle, water, okay? So when you go to sauna, and when you go out of sauna, you have less water, you are slim, and you are very happy. Or when you go using some kind of drugs like diuretics, and then it make the urine out, or so you think that you're happy because your weight is slim. So are you proud of that? Okay. So if we are not clear with this, we will be happy with the less weight, with very, very strange or weird method of losing weight. Okay, so they call it weight, and they think that when you talk about obesity, the CDC said that it relates to disease. Okay, it means that you may have some kind of joint pain, or you are obese, or you have some kind of diabetes, you have cholesterol, triglycerides, too much, you have hypertension. So that is the way that people think, or CDC think, but look at WHO. So why the definition is different? They look, overweight and obesity are defined as abnormal or excessive fat. So we talk about that. Okay, so to be precise, obesity, we just want to get rid of fat, not muscle, not water, not our precious bones. Okay? But when we use very, very bad methods of losing weight, what we will get is, khao sai galaxy. Or many boxers, boxers, when they are going to being weighed, they just don't eat anything, they just spit out, they just go out in the sun and putting the, kind of like sweater, they sweat, sweater is wet, okay? So they sweat a lot, they remove water out, and then with their only underwear, and they go to the scales, and so they be very leanest as they can, so that they will compete with the, kind of comparable weight. And after that, after weighing, they eat a lot. so that they resume back everything. Okay, so that is tricky. Tricky is not. So losing weight in that situation is not losing fat. They are losing water. So if you, in the first 3 days of fasting, you will be very happy because the weight is losing very rapidly. You know, rapidly is the going out of water. Water is easy, so that when somebody got diarrhea, they just like, okay, they just lose, like you have cholera. It is 17 liters of water out of your body. So that's why you lose very quickly, but it will resume back very quickly also because your body have to be balanced of water. Otherwise you will be like dehydrated, something like that. So the WHO has that definition. I think this one is blocking you or not? You okay? You see the slides? Okay. So Harvard. So I put Harvard here. Harvard just okay. They think that the words overweight and obesity are ways to describe having too much body fat. So okay, they use the same idea of emphasizing fat component. Okay, fat component. Also Mayo Clinic. So the university or the institutions that I put it here is reliable. So if anytime you want some answers, please go to these websites: Harvard University, Mayo Clinic. So that is reliable. Okay, so this is, so we see that in the WHO, Harvard and Mayo Clinic, they just put precisely that obesity concerns with having too much fat. So if you are athletes and you have a lot of muscle, please be confident that you are not obese. Okay? All right. So how to measure obesity? We are going now. Anybody got calculator or in your iPhone or your phone you got? We will calculate our own BMI or body mass index. So to measure obesity, we are calculating or using weight and height here. Okay? So here I just mentioned that in people who are, their muscle is hypertrophy or they have, we cannot reach this, okay? It's not our idol, okay? But if we just measure their body weight, can we define these guys as obese? No, they are just more and more fit, far more fit than us. But right now, you will see that the body weight is not all the time good indicator. But it is used in us. For us, it's okay. But for this, it's not fair. For athletes, it's not fair. Okay? Especially the athletes kinds of, using strength, they have to be, develop their body in like the 100-meter runner. They are very strong. Okay? So their body has been conditioned in ways not like us. So for us, BMI is okay. Okay, body mass index is okay, but for these guys, it's not okay. Okay, so please, you calculate the body mass index. So in this class, you can define or classify your own body as what? So anybody cannot calculate your own BMI? It is the body weight. If you are like 50 kilos, you put 50 and then you put the divide, okay, sign in the calculator and put it your height in terms of meter. Like for me, I'm 160 centimeters. I will put 1.6. Okay, because we have to divide it by meters, not by centimeters. Okay. By meters. For me, I am 160 centimeters. I have to use 1.6. So I will use 50 divided by 1.6 and again divided by 1.6. You put in the calculator 2 times. Okay? Are you getting your own BMI? 20. Oh, you are ideal. 20. Okay. I think it is confidential. Confidential, okay? And even we can compare. I compare myself when I'm in the elementary school or, in the Trem Udom Saksa school. At that time and this time, I have the same BMI. Okay? So, you smile. Can I ask you? Or it is confidential? 30 something? 30.88. Thank you for revealing us to know, sharing with us. Okay, 20. We got people 20. Oh, what about those who are in the back? You are so quiet. Or can you calculate your own BMI? I think it is for anybody 18? Really? 18? Oh wow, 18. Okay. Anybody got like underweight or something? 18? Whoa. 18. Oh. 0.7. Okay, you pass. 18.7, you pass. Okay. Anybody cannot or have questions about calculating BMI? I think for us it is fine. It's okay. Okay. All right. So anyone has thinking that what is the best BMI, the healthiest BMI? What? 20? 21? Yeah. Anybody knows what is the healthiest BMI? And are you 25? Too obese, right? Okay. Yes. Okay. 22. Okay. 22. 25. What do you propose? 20. Okay. 20. 18 to 20 is very broad. I think we just put one number. One number. 24. How old are you? How old are you? 59? 58. We are the same age. Okay? All right. Okay. So, 24 is quite a little bit higher. Okay? No, not. Okay, so we are sure body mass index here. So it is kind of like examples of those who are not sure, because sometimes in the US they use the units different from us. I think for us we are familiar with kilo, familiar with centimeters, but in the US they are inch. Oh, very confusing for me. Okay. But to express again that BMI, body mass index, is not all the time, and it is not a direct measure of body fat. Okay? BMI is not the direct measure of body fat, but it's kind of like the easy thing, simple thing, and they are used all over the world. So we can communicate with each other. So in different parts of the world, what is about the kind of BMI that you have? It indicates somewhat the healthy condition of your body. So this is from the website. So they are kind of like for those who are not understand what is the square, what the square mean, what can I treat with the square. So there are automatic. You just put the number of your weight and height in the website. Okay, they just calculate for you. So it's very easy by using web. It's calculate, or somebody use a table. Okay, no calculator, use table. There are many ways to help calculate your BMI. Okay, so this is in terms of inch and foot, and in terms of pounds, which we don't use that units. But in the US, I think they like to use that units. So you use cross two-way table. Okay, and here is again from the website. So you put it on website, you can get it. They put it here and here the weight. So you choose. Okay, that. Okay, so the categories after you get BMI. Okay, you can classify people in 5 classes: normal, overweight, obese, severely obese, morbidly obese. So in this room, I hope we don't have this one. And we don't have severely obese in this room. We just have a little bit like this. Only some persons here obese, and then we will have some overweight. So for those who propose 24, it's most like, close to overweight. Okay, but here I would say that these categories is for Caucasians. Is for Caucasians, please. Okay, and there are another underweight here below 18.5. Okay, we call it underweight. But again, below 18.5 is for Caucasians. I think we have trouble using that figure for our patients because for us, my students in the Chulalongkorn University, some students has 15.9. Very thin, and she is smart. She does not look like those who are like, he can get the A grade. So why? So in the, in the text, they use 18.5, but for us, maybe a little bit not true. Okay, so this is from the standards. The world standard, they use it all over the world, but it is the classification for the US, the European, something, the Caucasians, their body is quite, not the same as us. So this is the same thing. We use 25 as overweight and 30 as obese. So this we know for the Caucasians, the whites. Please guess, what about us? Is okay. Okay, 20, yes, 22 is still healthy, but what about in Japan? What about 23? Is obese. Okay. Healthy, 25 is healthy. So, okay, because I also study Japanese literature also. They use different Japanese and Thai and Asians is not using this one. So this is the guidelines. I just say that when you say in this slide, when you say 30, more than 30 is obese. That is very, big classification, but to, subdivided. We know that obese has degree, okay? We have class 1, class 2, and we have extreme obesity, okay? Or morbid obesity, whatever they use the word. Okay, so even though in the obese, above 30, there are levels, okay? So this you can get from the CDC or many websites. Okay, so this is what we call it Asian cut-off points. So if you are 23 and more, 23 to 24.9, you are overweight. Wow, in this room there are lots. Overweight. Okay, overweight. But 22 is still okay. Okay. Japan, I think Japan also very similar. Here, it means that if you are 23 something, you will be, a little more active, please. Okay? But 25 is obese, class 1. 25 to 29, but 30 is class 2. Class 2, sorry. Class 2. Okay? So the cut-off point is a little bit different because Asian people, when their BMI is at this level, they start to have disease, which is different from Caucasians. Caucasians, they got the disease after 30, but for us, 25 is having some effects. We can see, we have joint pain, we have the sleep apnea, we have a lot of liver disease, which I will show you. Okay, so this is from research. From research, not only, I think I want to reduce it a little bit just to jerk you up, okay? Okay, so this is the relationship, very classic graph. They use it all over the world, and also the insurance company. Because the question I say to you is that, what is the best BMI? So right now, if you are far away from the best BMI, don't be sad. Try to a little bit like move towards, move towards. You have goal in your life, okay? If you start to have goal in your life, you are, getting halfway. Good beginning, getting halfway. Okay? So this is the lowest at this button. It means that at this BMI, the death rate is lowest. So you live longest at this point, which is around, they say, 21. 21. This is for Caucasians, but for us, it will be 21. Okay? Because I think there are, somebody mentioned this one, but not very exact. I am 20, 22, or very sad, please. 21, 22, okay. Okay? All right. So it means that if your BMI is up 25, 30 something, the disease is more. The risk is up. Okay? So what I only want to emphasize to you is that this is from statistics, from the real evidence, not just we think, okay? And no, we know it for a long time, like Hippocrates. So we know that he just mentioned in his papyrus or something that, sudden death is more common in those who are naturally fat compared to the lean. So this is an observation of Hippocrates 2,000 years ago. 2,000 years ago. So he knows. He's very clever. Okay? So I think that the observation, we are not different from those people who are 2,000 years before us. So if we are getting fat, we have more disease. They mention sudden death, which is very, very, very new knowledge about that. Okay? So I don't want to scare you, but it's the truth. Okay? I don't want to scare you, but it is the truth that having more fat will do harm to the health. What? From head to toe. From head to toe is the consequence of obesity or having too fat, being too fat. Okay? From head, it is like stroke. If you have very high blood pressure all the time and don't go to see the doctor, don't take the medicine just because you said, I'm no slave of medicine, I'm free people. So you just don't take drugs, and then it is, dangerous. It's a kind of like, it takes years, but in the long term, it will cause dead tissue in the area, some areas, or it can be bleeding. Both we call it ischemic stroke or hemorrhagic stroke, whatsoever. Okay, so it is an increased risk of stroke, and from the head, the heart, the health, everything. Okay, and I think the most common is at the joint, the knee. I found very much, even though in small children, which I think it is unexpected. We found small children like in the kind of grade 5, grade 6. They just, if they're too fat, they are having knee pain. So that is another good sign of their health. Okay, so knee pain is very common. It is the physical effect because it is heavy. And if somebody, their legs are small compared to the body, okay, so it means that the leg have to bear the weight, a lot of weight. And if the bones is not very good, it will be like some kind, it is like this, okay, it bends, okay, and it have pain. So what is the consequence if somebody have knee pain? What is the consequence? Are they getting fatter? Because lack of activity. So when the situation is, when we deal with the patient, we want, the doctor said, please do the nutrition counseling for her to reduce like 10 kilos. But she have knee pain. It is very hard because she can't walk. Every time she walks, it is pain. So if it is up to that situation, it is very sad, very hard to reduce the body weight. So please being, early enough to treat that before you get a high BMI, okay? And liver here is very bad thing and is very early thing to suffer. Thai people are, the people who got liver disease, I think very, very top ranking in the world. Not the good top ranking, it's a bad top ranking in terms of liver disease, whether it is alcohol drinking and hepatitis, and also obesity that makes the inflammation of the liver. Okay, so that is the bad thing. So we will classify the health consequences of obesity. I think in terms of the food itself, the type of food itself, or in terms of because of the weight. So we will see on the right, I think it is easy for you to understand. And if you are assigned to take care of obese patients, please be, mindful that that patients will suffer more. Okay, what? Surgical risk. If she or he has to, elective surgery, it's very, very difficult. It will have more complications, more like longer hospitalization, more infections, things like that. Okay, and the kind of like respiration, okay, will suffer because the airway of the obese. Okay, so the lung disease, sleep apnea. Anybody have sleep apnea in this room? Yes. So my husband, he has to sleep with a CPAP every night. I am very familiar with, in bed with those like, space wearing something like that. So they're very suffer from sleep apnea, okay? And bone and joint pain, we call it osteoarthritis, infertility, pregnancy, difficult delivery, reduced agility, walking, things like that. So obesity in terms of the size, in terms of the weight, it has, consequence. And in terms of, because a lot of food that you take here in this part, what is the problem? The problem is you have too high calorie, too high sugar, fat, and sodium. This is the too high, and too low fiber, fruit, veg, grains, things like that. So the problem is kind of metabolic problems. Metabolic problems is very easy to see. Diabetes. I'm sorry, in this room, anybody have diabetes? So you have some, okay. So we have type 2, I think it is type 2 diabetes, okay. High blood pressure, hypertension, cardiovascular disease, gallstones, okay. Cancers, a lot. I will say it in the afternoon and the early days. So this is kind of like a example. In fact, obesity have more consequence. So we will see that somebody argue that Ajahn, some obese do not have any disease. Why? Because they are obese, they are fat, they are big. Okay. So the problem is, okay, this is what we call the regional distribution of the fat or of the body weight, because I have mentioned to you that we are familiar with the pear-shaped and apple-shaped obesity. So normally, what is the ladies have? Which type? The ladies? Yes, apple? Pear, yes. This is for the man, okay? So the guy, the male, have almost like in this part, and in this part we also call it android, okay? Android type or central obesity. It is the obesity because the fat accumulation is in the kind of in the abdomen, okay? And that is the most dangerous type. So for some, I've seen in the many those who sells foods in the market, very big ladies, but because how they are big, they are like they have big ass, okay, something like that. So some girls they still have like shape, their waist is quite good, but you know, so it is like African. You see African ladies, oh, their bottom is very big. So here, at that point, it is very strange that kind of fatness is less dangerous compared to here. So I found like Indian, I don't know, there are Indians in this room, okay? So Indian type of fatness is like central obesity. Yes, okay. So even girls, even ladies, I saw this kind of apple, okay. So apple obesity is more dangerous, okay. And because I go to New Delhi many times with WHO, the office of WHO is in New Delhi. So I found that there are a lot of Indian ladies at this and because sari, okay, your wearing has no size. Okay, so I got idea to deal with the monks from sari because I saw that when you don't know the size of your clothes, you don't know that you are bigger. When you are not aware that you're putting more weight too much, you don't start to think that, oh, what happened? Okay, so you will get more and more weight. Don't, aware of yourself until, okay, so that is because the size of the blouse or the size of your, the clothes is very important. Okay, so this again, I just put it on just for your curiosity of somebody that this is a very famous comparison. When you have two persons at the same BMI, two persons with the same BMI. This is Dr. I can't remember his name. He is in London in the UK. He is in India or something. And this is his BMI 22.3. Okay, but for him, Professor, I think he's Professor Yatkin. Oh, okay. Yashnik and India, Yashnik is here, Yatkin, UK is here. Okay, two people. he has the same BMI, but look at the fat percent body fat. Professor Yatkin has only 9% fat, quite lean. In male, average percent body fat is 15 male, but for ladies it's maybe around 27 to 30%, 27% because ladies have more fat, natural, okay, breast or something. Okay, so he is quite lean compared to common guys, but here Professor Yashnik here from India, he has 21%, like the man in the back row. I said from my eyes, I think you have like 21% fat. Okay, so this is when they go to kind of like have a scan, very detailed scan. They know the health of these two people is not the same. Okay, so that's why I would say that BMI will be just general idea, but in depth, that by you looking at your picking up the fat from different parts of your body, and how much fat, excess fat you have. Okay, all right. So to see that the excessive fat is the real thing that you will say people are obese or not obese. So the regional distribution of fat is, if it is the gynoid or the female type, it will be like the lower body is fat. But if it is the male type, the android type, we call abdominal obesity or central obesity here. So the risk is related with this type, with this type at the belly, okay? And so, again, the regional fat distribution will be related to disease and to death, okay? And it is first noted somewhere like in the beginning of the 20th century, and the android or the central fat distribution will result in the high free fat level and the high glucose and insulin in the body. So I think this is too scientific, but just only let you know that the central obesity is somewhat have some health consequence. Okay, so right now, I'm sorry, I don't bring the measuring tape. Sorry, but I think sorry, because so BMI for you is too simple. You need to measure your waist circumference so that really it is a better indicator compared to BMI. Waist circumference is better. Okay, so we will hear many things like waist hip ratio, but I would say for short, I would say that the simple waist circumference is better. It's better because for those who have big hips, you will have excuse. If you have big belly but you have big hip, so the ratio is causing out each other, okay? So please don't use ratio. Use the absolute value of the waist circumference. We have comparisons, okay? And right now, the thing that is the best indicator in the world, I would say, is the waist height ratio. So please calculate for now. What is your waist height ratio in terms of centimeter? In terms of centimeter, your waist circumference, your waistline in centimeters divided by your height in centimeter. What is the ratio? อันนี้มันจะเสียเวลาไม่เป็นไร I think you remember your own. Oh, there are those who have. Okay, so somebody have in the back row. Yeah, they have the measuring tape if you like. So I think you remember. If you remember in inch, you can multiply by 2.54, okay? Multiply by 2.54, you got centimeter from inch, because I think in Thailand we measure our waist in terms of inch. Pardon? Good number, yes. Please wait a little bit. Wait. Or you're not excited. I hope you are very, very, excellent. And what is your ratio? Point? 0.3. Oh wow. 0.3. 0.5? You have 0.5, okay? 0.5, okay? 0.5. 1.5, 0.3, 0.6, Pigeon. 0.6. 0.6. Okay. What was yours? 0.5. Okay, a lot of 0.5. Okay, any other numbers? 0.47. Yes, you can have decimals. 0.47. 0.4 something. Point. Anybody have more than 0.6? 0.5. Yes. Okay, a lot of 0.5. Okay. 0.6 something. 0.9. Okay, 0.9. Okay. Oh. Should we? Okay. So this is a very funny joke. Twins. So he may have the kind of genetic, same genetic, but they have different waist to height ratio. Okay. So this is before going to waist height. We have the circumference. This is the waist circumference for Caucasians. First, for Caucasians. Okay, for Caucasians. But in South Asian, India use the men is 90. India, okay. Japanese here. And we use, right now we use, in Thailand we use 85, same as Japanese for the men. Okay? And for the women, okay, they have different numbers, but Thailand we use 80. In Thailand, for the ladies, we use 80. So anybody above 80 centimeters, there are health consequences. Okay, and this is Asia Pacific cut off, which will be different, lesser. Number is smaller in Asian. Okay, and you can go to the website. It is in the website. The Asian Pacific region cut off. Okay, waist circumference. Here is the thing. Okay, at 0.5 is the cut off. You are in the cut-off point of, health risk. If you have 0.5, for those who have 0.3, 0.4 is okay. Okay, very good. But if you are above 0.5, it means height divided by half is the slogan of okay, of Thai health. Height divided by half, สูงหาร 2. Okay, สูงหาร 2 is the the thing that we know we should not exceed that. Okay, 0.5 is the border. And for monks, Thai monks, the average waist to height ratio is 0.48. 0.48. So it's because that is average, you will see that there are some people in the above average of that. So we stop at the point of measuring, and I think measuring is very important because it is kind of like a clear and solid thing that you can see how fat you are, or people near you or people around you are. And I think whatever we learn, we should learn what we apply to ourselves okay, before helping other people. So I have the next slides. I'm sorry. Okay, so this one may be not very desirable slide, but I think I want to emphasize the consequence of fatness or obesity in terms of liver, because I think other people talk about the stroke, talk about the lipids or the fat in the blood, cholesterol, triglycerides, you know that. But I think liver is the thing unseen. So if you just touch your the right side under the breast here, you will know that this is the place of liver. Okay, and liver is quite a big organ here. And if being fat, the thing that is unseen is the thing that happened in the liver. It is silent. It is silent, but it is like I think it's significant. Silent is that this is the first one is a healthy liver. Everybody, it's pink. It's kind of like look good liver. And then if the fat that accumulates, this is the liver that has fat inside the cells, okay? Here, okay? Inside the tissue here. And then the liver becomes like a little bit yellow. So it is a fatty liver, okay? If the fat is penetrating in here, so at this point, it takes years. And then after that, it is kind of like an inflammation. Here, it is inflammation, we call it hepatitis. Because the liver cell said, oh, I cannot bear it. I cannot bear the fat that is around me. It is unusual. It is not my nature. So here is the stage, 10 years, 5 years, depends. Okay, so at this point, the good news is that if you are fat or your friends or your relatives are fat, at this point, it is still reversible. That is the good news. If you have ultrasound check, you see the fat part of fat accumulation in the liver, and after weight loss program or something, after behaving, dieting, you see that the fat in the liver is gone. It's gone. It can be gone. So please, at this point, it can help the liver, which it feels very, in Thai we call it okay? You make the liver cell like be wrapped by the fat. Okay, they cannot work. They cannot work, and liver is the very, very important organ in your body. It do detoxify things. It helps you handle the drugs that you take. So please reserve the liver to function as long as it can. So please, be good to the liver. Please enjoy, okay? Enjoy the liver because it cannot talk. It cannot say, It cannot say, it is silent. So please, it is the same thing like what happened in the colon. The colon cannot speak, but if long time it develops cancer because the way people eat. Okay? So here, the good news is it can reverse. Please do it. But if it is long time until the cell is dead, then the liver, which is kind of like a bigger because of the fat, then it becomes dead. And with the scar tissue, dead is dead. Gone for good. Okay? So if at this stage, it cannot be reversible. My mother died with cirrhosis. So I know what is the suffering in those years of cirrhosis. It has been around 10 years. So that is a great suffering. So please don't be at this stage. If you are at somewhere here, so please, hey, getting up. Okay, so it takes years. Liver can be scarred. In 10, 15 years from healthy to cirrhosis or the dead tissue of the liver. And you cannot see it. It appears the same as normal people when you look outside. So my mother, she looks well. She is fat. She's like 80 kilo weight. Okay, so she looks very nice, but she has cirrhosis. Oh, that is very, very bad thing to happen. Okay, here, and that relates to central obesity. What I would like to emphasize is that their weight is not too much, but their belly is big. You get what I say? Some people legs are small, hands or arms small, but here big. Okay, the overall weight is not too much if you use just only weight. But look at the belly, okay? And here, the big waist will relate to here. This is the normal liver cell. But when the fat droplets, penetrates here and there a lot, so they cannot function. They got inflammation. They just, I cannot work. Okay? So here is the liver in that part, which we will not feel it. It is silent phenomenon. Okay? It is silent phenomenon. So please. Okay. So next, after liver, I will go quite fast, okay? Because you know that when we talk about the consequence of obesity or over fatness, okay, we talk about because of the weight effect, and this because of the metabolic or the food effect that our participant has raised the question about our break today. Okay, it's quite like support or help make our blood flowing with the sugar. Okay, so this is the BMI levels. So why we should know BMI? Because all the research will relate to BMI. So if you are here, you are related with the higher risk. Okay, if more or higher BMI, it relates to higher opportunity to get diabetes. And you know that diabetes is one of the disease that has a very, very tragic consequences. Consequences. You can be blind. Renal, the kidney will be failure. The heart fail, or everything. The kind of the leg can be cut off, which I will show you the picture of the monks that we have connection with, and he become our presenter because his leg is cut twice. So that is a tragic story about these kind of BMI that we don't care of. Okay, so these I don't want you to just capture all the message. Okay. But just to let you know that for those who are, keen to pursue these, you can. There are studies. The name of study is from Harvard. Okay, the Nurses Health Study, which is very famous. They deal with I think 20,000 or 30,000 nurses in the U.S. So that is a very good quality studies, okay, and that review a lot of well-known. We know that high BMI relates to more diabetic risk, okay, just like that, okay, and this lipidemia is higher kind of cholesterol, because our participant said, oh, her risk is kind of 0.3 with very low risk. Why I have very high cholesterol? So we should know that obesity is not directly related with blood cholesterol. It relates to triglyceride. So you have to differentiate between two kinds of fats in your blood. In your blood, when we mention high lipids or high fat in the serum, it can mean high cholesterol, it can mean high triglyceride, different, okay? And cholesterol levels. One major cause is genetic. And if you trace back your mom, your dad, they have it. So if people very lean, they can have very high cholesterol. It doesn't relate with fatness, okay? So that is different thing. So the kind of obesity that affects cholesterol affects HDL. So cholesterol has kind of like at least 3 types. You need to know what cholesterol you are talking. HDL is a good cholesterol, but LDL is a bad cholesterol. So I think for you, maybe like LDL cholesterol is high, okay? Because we want HDL to be high, H high, okay? H we want high, but L low, L we want low. So if L is high, no good, okay? That is a trick, okay? So HDL for me is 98 or something. Okay, so I think I'm hyper, hyper lady. So that my doctor said, at your age, okay, your HDL should be like 30, 40 something, but for you it's like 98. So it's very strange. Okay, so HDL is the kind of the thing to reflect your fitness, your, how good the condition. If people are fat, HDL are low. Anybody have your own HDL value? 96? Okay, so we are friends. 171. Okay, so other people have your own HDL? 35, okay. 43, good news, okay. Anybody? 86, yes. So that's why, okay, your look, okay, quite lean. So those who are, when your shape is large, okay, your HDL will be low. So HDL, we should keep it more than 40. 40 for men and 50 for those ladies who are still menstruating. And if you are menopausal, you can be like use 40 like men, okay? Fine. So HDL it has a reverse relationship with the BMI, which is here, okay? And here is the coronary heart disease in men, okay? So it means that, okay, with the higher BMI levels, the more they get coronary heart disease. So it's simple. So I just show you the fact, okay? This is from Circulation, long time ago. And here, coronary artery disease is, okay, this is from the internet. So you can search it, okay? It's from the internet. What I want to emphasize is the fat here, the yellow part here, okay? So right now, if we feel our belly, okay, the fat that is here is the problem. We call it central obesity. And what I have mentioned about our friends Indian, okay, Indian, Bangladesh, Sri Lankan, because I have been lecturing in Sri Lanka, Medical Association has invited me to talk with the doctors. So Sri Lankan has the same kind of like I think genetic trait like Indian. So South Indian have a very high risk of diabetes, very high risk, and then here the very high risk of also coronary artery disease. Okay, because the trouble here, we call it here visceral here. The fact here is the problem, visceral. So you can see somebody is like this, okay? And again, hypertension, blood pressure. So higher BMI is, it makes more hypertension, but again, it's like cholesterol. For those who are very lean, still you can get hypertension because of stress. So there are other factors, not only BMI. And still you can see some people with a very fat, but their blood pressure is still normal. So please understand that it is kind of statistics. And be careful that even though you are lean, you can have hypertension, okay? Because of how we modulate our stress. That's why I think Dr. Mano and the team try to reduce your blood pressure by the morning, okay, meditation, and the afternoon meditation. I think your blood pressure is going down, okay, stroke here, okay. So I think that's common because the blood vessel, okay, if it has a lot of fat, a lot of cholesterol, and less good cholesterol, less HDL, the fat plaque in the inner wall of the blood vessel will be clogged, and that brings about stroke, gallstones, okay. I would like to say, okay, OSA, sleep apnea, okay, sleep apnea. I think many people got that, and some people, doctors say, okay, you have to go to the dietitian just to lose your weight, because that is one way of helping those who have sleep apnea. And I think that is the very problem. Osteoarthritis here, there are many joints that will be troubled by obesity, and there are the problems, the medical problems here. We mean overall problem, surgical problem, medical problem, symptoms, health care utilization. I think you are kind of volunteers here. You know that if you meet obese patients, if you have to, if you have to take care of obese patients, you know that there are higher risk on many aspects, especially for surgery. ICU patients is very troubled. Okay, so please understand. I have in the end of the session the kind of example of that. Colon cancer is very much related to obesity here, colon cancer, and psychology. I think the psychic status of the patients of the obese is not very good. They are not self-confident. They have, kind of like mocking or I want something like that from especially for those who are obese from children. So their mentality is not very good. Okay, so obesity is associated with impaired quality of life. Okay, impaired quality of life, and then lastly, economy. Okay, if you are obese, you can calculate your, the budget. Healthcare budget is very high. Okay, so that is the national estimates cost of obesity. For anyone who is obese, the insurance company can calculate what is the cost. Okay, and the medical care costs of the U.S. are, in 2008 it cost $147 billion, not million, billion dollars. Okay, and I think I have this is the total cost in U.S. medical care cost. from 6.5% to 9%. Okay, this is just only related to obesity. 9% of the healthcare costs, and they say that, oh, it's kind of only second to tobacco. Only second to the very bad factors that contribute to the healthcare costs. Only second to tobacco is obesity. So we know that we have to prepare a lot of money for the consequence. Okay, and this is the risk. So at this point, I just want to emphasize about the details of those patients who are obese will suffer. They will suffer more on if they have surgery. If they have surgery, they will suffer more on heart failure, atherosclerosis, high blood pressure, heart disorders, blood clots, poor exercise capacity, pulmonary hypertension related to respiration. So the obese patients will need more close attention. Okay, so that is the suffering. So I think right now you may, try to be more fit. Okay, please. When I have major surgery, I go to exercise more. And when I have surgery, everything is out. I don't have any signs of female gender anymore. I don't have uterus. I don't have, because they are taken out. But in the afternoon, 1 o'clock, I have surgery. Okay? At that night, 8 o'clock, I stand. And then please take the kind of, IV fluid, anything out. I want to walk. But only after we have, we prepare. I prepare myself before. So I get up or, recovered very fast. So that is how we will help our patients if we know they are obese and if we know they will have to pass the surgery. So please let them a little bit exercise to be as fit as possible, and the consequence will be less. Okay. Next is this is from the internet. You can see that there are the preoperative management of the morbid obese patients. This is from, I think, from the UK, something London. Okay, it's the preparation of the doctor for anesthesia. Anesthesia? Okay, anesthesia doctor, they will have to be very well prepared. They have protocol separately, especially for obese patients. They have to be alert. Otherwise, the obese patients will suffer. Okay, so they have hand out. This is the manual. Example of the manual. This is in 2007. So they have key recommendations. You can find it is downloaded from the internet. Okay, so they have kind of emphasize different key points to be alert for doctors to deal with. They have kind of special device for special help for those who are very obese, and then when they lie on the bed, they risk breathing very normally or not normal. They have to be aware of that. Okay, so this is the risk reduction. I quote the website just for you want to download it. Okay, so this is the risk reduction. Okay, they have to be prepared. So if you deal with obese patients, you can have the patients prepare themselves as best as possible. And when they go to elective surgery, they will be, recovered well, less complications, leave hospital earlier. This kind will happen if they prepare themselves better. Okay, so that is the point. So right now, I think I would like to talk about the causes of obesity. So you will see that this picture is very much used. That is when people are, in our age, here's the shape of, I'm sorry, it's just only the man, okay? It's not a lady, so it's just shaming is putting the lady, so we just talk about men. Okay, so it's kind of when we reflecting, hey, what happened in Japan? What happened in India? What happened in Thailand? Why the shape of people are changing? Why we have a lot of belly like this? Do we what happened? Okay, so I just summarized in a very short slide here, just to make you know the kind of principle, okay, in short, that yes, genetics involves 25 to 50%, because I don't know which lady have asked me in front of the toilet. She said that I try very much to lose my weight. I try very much. Why it is kind of like a very low result, or it is not impressed, or why am I so easy to be fat compared to my friends? Compared to my friends, why my friend can eat, and they are not obese. But for me, I just breathe. I just breathe. When they just cry, and infant is not likely to be obese, okay? But because they have a lot of activity and they have to generate a lot of heat, okay, for small infants. So brown fat tissue exists or be there at the infant period. But when we grow up, that brown adipose tissue gone away somewhere. But right now, they just notice that some guys or some people have more brown adipose tissue than other. So it explains that why some people are very easy to get fat, and why some people can eat whatever they can and not fat, because they have inside their brown adipose tissue. That kind of fat tissue is a kind of and the kind of generate heat. So it means that why some people their hands you get cold very easy. For those who get cold very easily, that kind of reflect that you will get fat very easy. Okay? Do you notice yourself? And somebody says, oh, it's very hot. Why this place is so hot? So your body generates heat very easily. That means you are kind of energy, consuming body. And then you are fat, not easily get fat. Okay, so I don't know whether this theory or hypothesis is true or not. You just check yourself. So I just tell the girls out there that we have to accept ourselves. For me, my mom is weighs 80 kilos. My sister weighs 70 kilos. I am the only one in the family who survived with number 5 kilos in front. 50 something. Because others is 70 something or 80 something. So my genetics is quite not favorable. But I accept that. I behave. I have to put more effort. You look at my break. I just eat only the angle of the green one. The other I left it there. That is me. Because I am the one whose genetics, I'm getting fat very easily. I'm also getting cold. Anywhere I have to, I have to bring my sweater everywhere, So that is me. I accept myself. I will get fat easily. I have to behave more than our friends. I will not be jealous when my friends can eat, and I can't. Okay, we will be happy. Learn to be happy. I think Dr. Mano will teach us on that kind of happiness, being me, being myself, getting fat easily. So we learn to behave in our eating until we get the point that we are happy with. Okay, so that is genetics. We cannot take genetics out of ourselves. We cannot. Okay, so we have to accept that with our smile. Okay, and lifestyle. This one is has a lot of influence on ourselves, on our children. Okay, physical activity, mentality, eating behavior. You stop everything at your fridge. When you open your fridge, everything fall down because you stop. Okay, that is your behavior. So clean it. So if you look at the fridge at my house, oh, mom, nothing to eat. That is my intention. I don't stop, even though I can. I don't. So we just be very poor. Behave like very poor and stop everything. So that, it's very hard to get things. But if you plan your house, in every cardboard, in every board cabinet, a lot of snacks, in mountains of snacks, what do you expect your children? Because a lot availability. Okay, so that the behavior, the frequent eating, the drive is more fast eating, high fat preference, high sugar preference, night eating syndrome. So this is the behavior which we have to try to realize what we will deal with it. Which one? The crisis handling. If you're sad, you eat more. If you're happy, you eat more. If you are excited, you eat more. So every time, every event, eat more. So if the crisis handling, the despair, if you are hopeless, eat more. So and if you projection, why he left me, I eat more, why he left me, projections. Okay, so that happens. If you are that type of person, sure you get fat. Okay, associations, okay, compensations, everything with the desserts, chocolates, okay, chocolate lava after you, or those kind of very the cake or okay. So this is the physical activity which I think we know. I just bring up the statistics for you to see that it is really the TV time for us when it has this political situation. We watch TV, okay, cable, Gamnan, everything. Okay, 3 hours, 5 hours. Okay, this is, obese children and non-obese children, the time that we use to watch TV is very long, more than 2 hours a day. And if it is like that, our children and this generation C, in the future, they will, have health consequences. Okay, so I think that when we talk about obesity, we're not just saying that, okay, eat less, walk more, stop, full stop, here, we leave the room because nothing to learn. But it is not that easy. Not that easy. So that these days, people say that, okay, when you leave the room, or just when we think about the break, I'm sorry. When I mention your coffee break, I don't mean to, but I would say that this is normal because when you plan a very healthy snacks, it's not easy. Normally cake. So we just have, and when we determine protein content in the snacks, fiber content in the snacks, so instead of giving this kind, we place more with the fruits, better, because in the afternoon we will mention about the good things of fruit, okay, but they have a little bit, okay, fruits here in this morning break, okay. So but the ready to eat food is the trend, okay, and this is the TV, the hours for TV is increasing, okay, with the obesity. If you watch longer, you get more obese. Okay, so there are people who do the statistics here. And right now, I will mention a little bit on conventional way of reducing body weight or body fat. Okay, I will get quite fast on this because it is very conventional. The first thing is the goal. The goal. Put realistic goal. Normally, I think somebody will come with 30 kilos aim and how fast you want that in 1 year or in 6 months. Can you do that? If you calculate it is possible or not, because you gather or accumulate that fat for 10 years and you want it to go away in 6 months. So the goal is not realistic, or maybe it is not the goal of the patient, but it is the goal of the doctors or those who take care. And if the doctors aim at too high goal, what happened to the patients? They cannot, they are discouraged, right? And they just say that, okay, stop it, go away. Don't even think about it, okay? Because if we put the aims too high, it cannot be possible. So in terms of medical safety and possibility, it is 5 to 10% of the initial body weight in 6 months is realistic, okay? For example, if we start with those who are 80 kilos, and 5% is what? 4 kilo. 4 kilo in 6 months, see? So it's quite kind of like, yes, very steady. We don't like jump. I sleep this night and tomorrow I became the new person. So this is the kind of the dream of those patients who want things quick, but it can't be possible to be quick. And exercise is important still, okay? And sometimes it is not necessary to be programmed exercise, okay? It is move more like me. I'm like monkey right now, okay? So I move more. So, and strong intentions. That's why when we do the weight reduction program, we need friends. We need the peer. Okay, we do it in group. That is more successful compared to individual. So if you have friends, you will encourage each other. Okay, let's start. Don't lose heart. Okay, we start and we go steady. Okay, because when we we behave and we diet for like 2 weeks, you will go back to your friends and you will very, very much expect your friend to say, oh, you look fabulous. But instead, nobody talk about your, and you will feel like, oh, I have tried very hard. Nobody mentioned my new look. Because when you wear your old shirt, when you wear your old, trousers, it may look the same. People say the society is slow. Society is slow, and you will go wake up in the morning and you say, oh, don't you look good? So you say, no need, no need to let other people say, oh, you must lose weight a lot. Don't expect, because you will be, okay, So I would say that in terms of losing weight, you have to be, smile to yourself, give energy. So encourage yourself every morning, okay? Smile, and then if you fail, you start again. So if you say that, my friend, do not appreciate it at all. So please don't expect people to see that you are, leaner. No, they just very slow. It is like 1 month or 2 months before they can, they can kind of like observe, oh, you changed. You almost dead at that point. But if you are good at yourself every morning, you just, oh, today is better than yesterday. Okay, so please do it. Okay, so this, pardon, okay.
The opposite is also true. I went on a low carb diet and then everybody asked me to put weight back on.
Okay, how long do you on in a low carb program? How long?
3 months.
3 months? Oh, you are so hardcore. Because it is very hard, low carb program is torture. Okay, so that's why you mentioned about the break, the non-healthy break. Okay, so I think this one, if you talk on the real weight loss program, is a long session. It is a very, very much nutrition counseling, but I am saying that it is about changing one life. Changing one life, really. You have to change life, so we have to encourage a lot. Because if we are successful, we can, the consequence or the benefits that we have is huge. It's huge because we change the life from, very bad behavior to a new life. I take 25 years for my husband. My husband lost more than 20 kilos. 25 years. you lose heart? But, these 25 years is a long story. Sometimes like this. The weight is like this on a low carb program like you. And sometimes it is like this. Yo-yo. Okay? So it's not a very, very smooth story. These 25 years is like, it's a cruel life. But if we know that when finally he came to the right track, he came by his own. I didn't pressure. I allowed him to eat cake. Not allow, I didn't touch. Normally I don't like to use that method. I think that is harmful. So I don't mention about these things. But finally, he realized what to do. He sees me eat every day. He sleeps with the dietitian every day. Okay. So, in the end, but right now, his health is marvelous. Everything controlled. He has hypertension, have this lipidemia, everything, knee and everything, gout. Pardon?
I have 85 kilo hazard.
Oh, it's not 85 husbands, okay? Oh, I'm jealous.
Earlier, you have mentioned that obesity is about excessive fat,
Yes,
not the weight.
yes.
I wonder why not we choose realistic goal in body weight reduction, 5 to 10%. Why not 5 to 10% waistline?
Okay, good. Okay, because this is very conventional. I would say that this is conventional because people are familiar with weight, not familiar with waist. Okay, but right now, when I will show you with a monk, I have no weight goal. I have waist goal only. Okay, thank you for the questions. So that's very good. Okay, because waist is more reliable in terms of if we just want only in terms of the kind of health, you lose your waist, you get more health. Okay. Okay. So this is the weight control, the months. I'm sorry, I would like to skip this because it is very, very conventional how to help people move more with the exercise. Okay, the weight control and the only point I want to say here is that a rapid weight loss during first few days, mainly from water. So don't be like, oh, very happy, but it is water, okay? And, okay, so the next thing I want to say is just only the diet program. It is very fashion, how people would Atkins? Here, it is the Atkins answer. So this is the picture I take when I stay in the US. So every day they have, ad in the TV. They have this kind of diet, those Weight Watchers, they have zone diet, they have a lot of formula diet. So people are thinking, oh, which one is best? Okay, so I would say here about the program that exists. Okay, there are different types of program that exist. Okay, it is low carb. Okay, like one of our friends have low carb, which can be called ketogenic idea diet. Okay, there are high protein diet. There are semi-starvation diet. Okay, and there are high carb, low fat. So there are different approaches. Okay, different approaches. So what I would like to summarize in idea, what is the efficacy, okay, of each diet. So the low carb diet, sometimes the disadvantage is that they don't limit fat or protein. They just say that low carb, okay? So if in that sense, maybe you have to also think about don't take or don't over, consume fat or protein too much. The low carb diet, I might say, is effective. But on the long term, okay, it will be effective like in the first 3 weeks. You will see that, oh, hey, you lose like, I'm sure that you can lose like 5 kilos by low carb diet. But is it real? Can you practice it lifelong? It is not. So yes, my friend, our friend, you shake your heads because low carb is kind of like tormented because it is not human. For us, we need carb, okay? And they limit carbs. So I'm sure that is not natural. If you can practice it for a specific period of time, and then you just want that period, you want to lose weight at that time, okay. But if you want your lifelong diet or lifelong weight loss, I think after you stop low carb, you get back the weight that you lose. Okay, so that is the things that happen because it is not natural and sometimes it is dangerous. Sometimes it is dangerous. For example, if you are on diabetic drugs, it is your carb has to be like steady, and if you take the drug but you don't consume, okay, you will get what? Hypoglycemia, which is life-threatening. Okay, so Semi-starvation is that you eat like 400 to 800 calories per day, below 1,000 calories per day. Okay, and if it is very, very low calorie diet, it is like 400 calories. So it is like you in Thai you eat khao tom, just one bowl of boiled rice, something. The calories is like that. So can you stand for all day with khao tom? Just one bowl. So it is like you will be advertised with some kind of formula shake, and that low calorie or very low calorie shake, and you just kind of follow that. But can you do that for a long period of time? It is not possible. So in the end, everything turns out that you have to diet and exercise. It is unavoidable. Okay, whether you use this method, technique, okay, and there are more. Like you will see that there are Soot Pratep, right? Okay, our Crown Princess formula. It's some tam. It is like many things. Formula. Somebody takes fruits all day. You can hear those kind of formula. But is that really, the life you will do it all along? It is not. So any formula, when you put in your life, you will see that whether it fits your life, maybe not. So I would say that in the perspective of doctors, they know, they read from the literature that there are researchers who report in terms of really data, and there are no differences in different methods, whether high carb, low carb, high fiber, anything, the same is the result. Okay, I will make it short because in fact I have a lot of slides on this. Okay, they have the zone diet, they have the Ornish diet. Atkins, Dr. Atkins is dead, and he is dead from cardiovascular disease. Okay, so please read his life, so you know that Dr. Atkins himself have the metabolic disease that he proposed on the Atkins diet. Okay, and I don't want to mention others, okay, because they are taping me. Okay. Oh, okay. Low calorie diet. Okay, here. So the low calorie diet is between 800 something, and very low is like this, less than 800. We call it very low. Okay, but I think this applies to Caucasians. For us, maybe a little bit like 20% lower, because our shape is smaller than than Caucasians. Okay, so this is the exercise tip. Okay, I would say that the diet, weight control or the diet control will need to be added with the exercise always. Otherwise you cannot maintain the weight that is losing, have been lost. Okay, here, because when you exercise, the exercise will help enhance fat mobilization from the body, okay, and protect against protein loss. So the better. That's why when we say weight is not the only thing that we think of when we want to do the weight loss program. We want the fat to go away, not our muscle. So those who are anorexia nervosa people. Okay, so anybody is Karen Carpenter's fan. Okay, singer. Okay, she is dead with anorexia nervosa. So those people who have these disorders, they are very lean, but still, they have fat. They have some fat, but they don't have muscle. So the change in that, so even though you see people who are lean, I can say because I have a lot of touching with national athletes, okay? And when I touch people, I know that people are, they have fat, they have muscle, or what kind of condition they have. Okay, so even though you weigh like 50 kilos or less, and you are happy with that, I would say not necessarily. Maybe if you are lean, but you don't have much muscle, it means you are not very healthy. Okay, so I went to Vietnam one time, and I saw that Vietnam girls is very nice, so slim. I even did not see many fat people, many fat ladies in Vietnam. But when I look again in her national suit, bao đài, áo đài, something, áo dài. Okay, so that national suit, I see that she has belly. Because at that time I go with the SEA Games reporting conference, and then they're doing dancing, and I just see her in a side and with her bao đài, and I saw that she has belly. So even though she looks so small, okay, slim, with belly, not good, okay. So even though your dress will high, but you know it, okay? Okay, so sedentary lifestyle like us now, sit all the day is not good, okay? So sedentary lifestyle will mean that you have more, mortality rates or death rates, or it's not healthy, disease, something like that, okay? And but one thing I would like to mention is fat but fit is better than lean, not fit. Fat but fit is that sometimes you cannot lose weight enormously or for what you want, but you can be fit when you are fat. It is possible. It is possible. So they say that obese men with a high level of fat of fitness had risk of death not different from fit men with normal body fat. That is good news. Okay? Because for somebody will say that to lose weight is, you have to reborn again next life. Cannot. Not possible. But you can do it in this life. You choose it. Okay? All right. I'm sorry. So here, I just want to mention to you that in human life, for example, my husband, 25 years, this is 10 years. Follow up. So in terms of weight reduction, you have to look long, not just 3 weeks. Nothing. Okay? 10 years, and you see that it is like this. Okay? One guy, I don't know, one guy, when they are on the self diet, they just drop and up again, and Weight Watchers, and up again, Weight Watchers again, something like this. This is the real follow-up. Okay? So real thing, prepare for real life. So you again talk to yourself, hey, you are great. You are. I talk about this from my own experience. My husband, he said that he have to be his own self-friend. This is the way that he can lose weight. he said that I have to be my own friend and I will give heart to myself every morning and he can. Okay, so we will say that when we lose weight, it is not as difficult as maintain. Not as difficult as maintain. So if you are here, how can you stay at this point? Very hard. Very hard. So you can again and again. So it's like you win the gold medal. It is hard to maintain being champion all the time. And be Sirikit, okay? He has been 5 years, you know, very popular figure, but this year it is James TRU, okay? Win! He cannot maintain it for life. So they are new winner. So here, maintain it at the lowest point is very hard. Very hard. I myself, I lose 10 kilos. I have my picture with the old one. So those who never under the lost weight program, you will not understand the mentality of those who suffer. Those who are lean will say, why are you so fat? I don't understand why you're so fat. So those who are slim never understand, because when you ask, hey, how about next meal? How about lunch? Anything. I will ask my friend, what is your kind of philosophy in choosing things to eat? She said, just to survive. My friend who is very slim. So those who are slim, don't think, why you keep thinking about next meal? When you are eating, my husband, when we eating lunch, he said, oh, this dinner, I want to go to this and that. So it's just like, oh, the eye is wide open. But my friend who is slim, he said, at this meal, she just eat it like no heart. So people who are slim don't pay much attention on what to eat. But those who are very exciting all the time, it's eating. Oh, what is new? What is new? Instagram, every dish. Okay, so they're different. Personality, different. Okay, so that is it. So I think, okay, I will say that why people are regaining weight. I read the paper from Harvard. They say that if you are honest, the nurses' health study have followed for 6 years and almost all regain or yo-yo. Almost all, 100%. And somebody even have higher body weight than in the beginning. This is the truth. So we will say that losing weight is not easy. It is like for somebody will say that next life. It is not happen in life. It is not like very pessimistic, but it is true. Really. Okay, but for some, okay, with the kind of strong intentions and be your own self-friend that can, be very pursuant on that, okay? So this is because when one person from this big becomes smaller, the energy expenditure is less. And even though you eat less, you will notice that you are not losing weight anymore. It is not like losing and losing. No, the weight loss usually occurs at only the first month. After that, maintain. maintain. Okay, so that is the truth of the energy expenditure that is less. It's like you are electricity, like you are electric fan, and you consume less energy, more economic. Your body, when they are smaller, they are more economic. They just stand only in a small amount of food to be at the same weight. Okay, so that happens, and you have to understand. And if you think that with this amount of food you will lose, gradually, it is not. It's just on the kind of first 3 weeks, 4 weeks, just that. And after that, it is with some tensions. Okay. So it is that this, right? Weight loss. It's not easy, like what you think. It's not easy. So I will say that empowerment is important. Empowerment is important, really. You have to be friends with them. I will not talking much on these slides because this is too much letters or too much information, but only that beverage or soda drink is the kind of key things that I would like to address, and this is what Harvard University is right now doing a lot of research on this, because before this we do not give more emphasis or don't think much or pay attention to beverage. We eat like green tea, we eat in the big cans, and we just say that it is just drink, but the calories that you get is huge. And this I deal with monks a lot, because monks can eat only until 12 o'clock in the midday. After that, he drinks and drinks, and that is the cause that right now obesity rate of monks is okay. So I sorry, I would like to skip this, the juice. Okay, so we are talking about environment that everybody suffers. We suffer from supersized food. If you go to you are like SF fan movies, you know that the popcorn. I eat many days that box, okay, and Coca-Cola or everything. These kind, like the size is more, and you said, it's very economical, it's very good, very cheap. You are okay, so you think about paying, and okay, that's good. You calculate, but you don't calculate your health. Okay, you calculate just the money. Okay, so this is why there are movements in the U.S. to make people aware of what the American is experiencing. Supersized food everywhere. So the glass or these bigger and bigger. Okay, are you pouring on the pounds with these drinks, this soda? Okay, this is the data in Thailand. The sugar consumption in Thailand is getting more. We have some data on sugar consumption. Okay, we have separate the sugar consumptions in terms of beverage. This blue line, this is food, the yellow line. Okay, this is milk. Milk is not very it's very steady. Confectionery like this, so you will identify that. The problem is what? Yes, this one is rising up a lot. Not with confectionery, not milk, is same, but the sugar consumption is via beverages. Very much increasing. Okay, I'm sorry. I will pass this one. I will go to the here. Consumption of energy. Okay, because this is the environment. Eat more, eat denser calories, food everywhere, low cost, good taste, high fat, those things, large portions, and the energy use is less. This is the lifestyle, the environment that we experience here. Okay, so big. I don't pronounce the brand. Okay, here, so you know that there are the portion size problem here. Okay, right now the portion size is bigger and bigger. Okay, so they say that this is if somebody bring back home this size of cheese ball back, what your kids will, okay, it is, you know, this big, okay, so the super size is, that's why, I'm sorry, I would like to mention my own that when we, this is the real thing, it's the real. When I did it and my husband observed or he just see how I eat. So when we have the whole bunch of the cake, I just cut one angle, small one, and I eat this. So when I see the food, I don't see the food in the whole shape. I just divide the food in fractions. So that's why in my house, for banana, we just cut it. We don't care whether, because when we want to eat it, we cut the you know, the brown one away and we just have it. So one banana we share, I share with my husband. So because people think that when you are given one whole, you know, piece, you have to eat all. But if in your mind you can cut it in small sections, in your own, in your own, you know that, okay, today I will just this, like this. So things are smaller. Things are smaller. Okay, don't like this. Very okay. So what we talk is portion distortion. Portion distortion. Okay. Here. So French fries 20 years ago in the US is 200 calories. French fries in the US 20 years ago is like this. Right now, today is like this. 600. So it's 3-fold more calories. Okay, this happens. I think, is it true? Do you think it's true? Okay, so the calorie difference is 400 calories. What? It equals burning, walking 1 hour, 10 minutes to burn. For me, I walk 1 hour full. I just burn only 200 calories. So 200 calories if you walk, it is like 1 hour. Walk very, you know, in the, like this, all sweating. Just 200 calories. So you will see that. It's only like one soda drink that you burn when you walk heavily 1 hour. So that's not fair. That's not fair. But it's true. Okay, so this is the drink, soda drink. How many calories on this? This one today? No. 250. 250 soft drink. Okay, one bottle. Right now, it's like this is big one, but in Thailand, normally it is like in a can. It is 140 calories today for Thailand. 140, half of this. But you know, it's still more than what we drink 20 years ago. So do you see the portion supersizing? Okay, and this calorie difference, you have to gardening 35 minutes garden, okay, so to burn out. But no, you are less physical activity, so what is the result? Fat. Okay, so this is the thing, a turkey sandwich. Okay, so today in the US, I think not in Thailand, but in the US it is like this. So that's why in the US all is heavy. It's like this. Okay, so you have to bike 1 hour 25 minutes to burn this 500 calories difference. So this is the thing that happened. Only the supersizing, this is the food environment that also Thailand has. Okay, the same thing. And snacking, we know, and this is sodium, and it will make our kids' generation hypertension or high blood pressure with this kind of, okay, snacking. So don't, you know, save it in your cabinet at home too much, okay? Okay, so it is just the slides to say to you that to reduce sodium in the food, you will reduce the risk. It is the plate model. Right now, we use the method, the plate model, just to know that half of that is the fiber thing. Half of the plate is a fiber thing. And you know, 1/4 is protein and 1/4 is, you know, rice or something. So right now we do it this kind of method to educate, okay, to educate how to eat. This is in the web. You can do it. You can download the choosemyplate.gov, okay, and this is in Thai. Thailand, we also have this in the website. I just demonstrate what I eat. This is what I do. Sometimes I have kind of like this kind of Danish or something, and I have this rose apple. I eat together. This is my life. Okay, and when I was served khao klong, right, in the box, they have too much rice. I cut it in half, and this is, you know, this is fish, this is veggie, and this is rice. I eat only this one. I cut it in half. Okay, so the smaller, the better. So life will be changed if you doing this thing smaller. Okay, so I just let you see that we have a lot of experience with the kids. Okay, in Chulalongkorn Hospital, there are a lot of, you know, fat kids everywhere. So you have to empower, because human life, we have staircase of decision. When you talk to the monk, he said that, no way, Ajahn, because I have to receive everything. When I have been offered, the layperson just watch me eat or not eat. Okay? So I have to eat all. My life is, I cannot do anything with myself. I said, no. I said, still, you can do it. Okay, so this is the way of empowerment that I do with the monk. So we say that we are not diet thriller. No, don't eat this, don't eat that, don't, everything don't. You will be the thriller, and they will not sleep after meeting you, okay? So we are not diet dictator. We are not player. Okay, eat anything. but we are motivators. We are diet motivators. So we motivate because human needs motivation. Okay, not fear. Okay, fear of everything. My husband one time when I pass him, he is in front of the fridge. He just I do not say anything, but he is thrilled when I pass. Okay, because he must doing something wrong. Okay, so we have nice food in Thailand. It is lucky you stay in Thailand because Thailand has a lot of very healthy food. Okay, and I just show you that with my students like this big. Okay, the patient I go to the rural in Raburi. Okay, I talk. Okay, with the patients. I go to the schools in the rural and then we meet this. I consult this also. I said, bring your kids. She is like this, wait for our call. Okay? So this is the kids in Chulalongkorn Hospital. We have a lot of problem here, a lot. And this is the signs. The signs. Black neck is the signs of insulin resistance. If you saw this, it means he will gonna have diabetes soon. Black neck, okay, black neck. Okay, so I'm talking with the monks a lot, and you know when you work with teachers, monks, doctors, this is the 3 items that is the hardest to work with. Okay, they have dignity. You can't say, oh, why you behave like this? Why you eat like this? You cannot say those kind of things. Okay, so this is a great guy in the Wat Pathum Wanaram, you see. That is จ้าอาวาส oh, very big guy. Everyone, okay? So this is me. Okay? And this is the monk whose legs is cut 2 times. I have to mask. And this is the months that we have the program in the brochures. We say it, the height, half, and then it is the kind of the waist that you should not exceed. Okay? So this is the way that we approach the monks, and the BMI of the monks, the yellow one, this is the monk highest compared to males in Thailand. The monks is here. Okay? And BMI, this is BMI 25, BMI 30. Monks top. Okay? And this is the waist. Okay? The waistline, the monks is, okay, lot. And then this is cholesterol. Monks is yellow bar. Monks is higher than normal male in Thailand right now. 52% of monks have high cholesterol. 52%, I say again. It means that 2 months it is 1. Okay? This is monks. Total cholesterol, HDL cholesterol, LDL cholesterol, all bad profile in monks. Bad profile. So I devise the media a lot. Okay? One thing is the belt. I call it smart belt because monks wearing have no size. Okay, so he never knows that he's getting bigger, fatter and fatter. So I have to devise this, and I got patent right now for this smart belt. Okay, because we have mark, so he knows whether it is too much, and we have measuring tapes specialized for months. Okay, so this is the calendar. Move more calendar. Okay, monks like it very much. Okay, and I just teach them that their blood vessel relates to these. That is it. And this is, even old monks, senior monks, they are very, want to participate. And this is the calendar. They just move more and they lose weight. Here, this is the model. This is the class session. And after we try 8 weeks with these medias, groups that is not trained have higher cholesterol. Groups that is trained is lower. And overall the differences is 40 milligrams per deciliter LDL difference, okay? And lower cholesterol, lower triglycerides, lower body mass in this program. And then I have bring up this media to our crown princess, okay? And this is Reuters, this is Channel 3, this is Thai PBS. So they are very amazing. Why are you have this kind of approach? It's very funny, but it works. It's funny, really. It's funny. Okay, so I am with the Thai PBS and Dr. Krisada, he has like putting on a smart belt. He is very funny with a smart belt. And then I demonstrate what kind of food to offer monks. Half white rice, half brown rice. We have proposed this to and vegetables and the fish. Okay, so this is and the curry, Thai curry, which is very top, menu. We said half coconut, half cow milk. So you replace the coconut milk with cow milk, half, and still very delicious. And this is the proof. We have fan club, okay? And the fan club is very exciting on what we cook for them, and we have exchange for these. Okay, this is at Thai PBS. Okay, and with the smart belt, every month is very funny. Oh, look at you. Every month, laugh or smile. Okay, so and with the calendar, the Channel 3 love the calendar very much. This is the calendar, Move More calendar, and this is the poster. We have both in English and Thai for healthy monk, healthy nutrition. So that we have just touch only rice, veg, fish, coconut milk. That's all, 4 components. And drink, we said that choose drink, think protein. Choose drink, think protein. And we have waist, the smart belt, waist not exceed half height. Waist not exceed half height. And then the walk more calendar, we just have the goal of 40 minutes per day of walking. So this is the way that we deal with monks, okay? And I think there are more to say about that. And the slimming pills, there are a lot of things. But I think today we have just only this time. So here, this is a miracle pills. But I would say that right now, still there are no pills, no dietary supplements to help with reduce weight. I just have the kind of short answer for this. And I think it's time for the MC.